Hello everyone, this is Dr. Jamshid here from Abeer Medical Group. I'm coming on this video to give you some information about the COVID pandemic and how it's happening in Saudi Arabia and what all we need to be careful while going through this situation. First of all, you must all be noticing the current numbers which seem to be on the rise. Every day the government is announcing the latest statistics across the kingdom. So this is probably the phase where we're seeing a small increase in the numbers. So what is very important now is to adhere to all the guidelines and the instructions given out by the authorities. The most important of that obviously is to restrict your contact with any outside members. So that is the intention of asking to stay indoors and to avoid any non-urgent or non-emergency visits outside. So the intention is for your healthcare needs, emergency healthcare needs, and for your essential supplies at home is only two situations where you're allowed to go outside. So that too, when you're going outside to especially supermarkets, because we are seeing some cases with no proper history of contact with any other positive cases, so which means that it could be getting spreaded from common places like this. So even if you're going out to common areas like supermarkets for purchasing something, make sure you go alone with protective gear. You try to wear a mask and try to wear gloves, and immediately after coming back home, wash your hands and face, and if possible change the clothes, take a bath, and then mingle with everybody inside the house. The other thing is that the mortality, whatever we are seeing mortality in Saudi Arabia so far, it's very less compared to the global standards. So in the world, if you look at it, it's around 4 to 5%, but in Saudi it is still 1.4 or 1.5, which speaks good about the care given by the government centers and the hospitals that are dealing with COVID infection. One of the reasons for high mortality in outside areas, especially in the West, is because of the high population of aged individuals or people more than 60 years who are getting this infection. So which is not the case here. So that's another reason. So it's important for people who have elderly at home, more than 60 age, or somebody with diabetes or hypertension or any other comorbid illnesses. So if you have this at home, if you have such people at home, you have to be extra careful. If you're somebody who's going out for shopping or any other thing, when you come back, make sure you disinfect yourself really well, take a bath, wash and all before you interact with your parents or elderly, and try to limit that interaction as well. We don't want to pass on this if we have to them. The other point is, the infection as such, the COVID infection or the coronavirus infection is not a death sentence. So don't be panicked about that. Majority of the patients will only have a minor respiratory symptom. And we are seeing these symptoms in our centers as well, where they come with fever or cough or a sore throat, and that just subsides by itself or with just simple medicines like paracetamol and all that. So it's not a death sentence. So don't be panicked about getting it. The recent studies says that this pandemic is going to last some time, and invariably majority of the population will get it in one way or the other, and that is when it will bring up something called a herd immunity. A herd immunity is where majority of the population in the area or in the country has immunity for this, either by acquiring low level of viruses and getting the immunity for that, or by vaccination. That's what we are doing for polio and some countries, where we are doing massive vaccinations at one go, so that everybody in the community has the immunity, and then that builds a collective shield against getting an infection. So we have to be careful not to get it, but in case we get it also, get medical advice as early as possible. So somebody who is feeling feverish or with any respiratory symptom, it's a good time to approach any healthcare facility. Either the government has got this number of 937 or 1937, where you can call and ask them, and they might send a medical team to your house so that you restrict travel, or you should contact any of the healthcare body who is nearby, and they would screen you, they would triage you, and if indicated, they would take a nasal swab and send it to government centers for testing. That is the approach that everybody is recommending now. Yeah, and one another thing is that, as I told you, the infection is not very serious in that such. because majority, or at least I would say a large number of people who are positive currently are also monitored in isolation rooms in hotels. So it is not, they don't require a very intensive medical care as such. They require isolation and they require monitoring. So that is the basis of the therapy now. Third thing is that, what we can do to try to prevent this. Obviously, the most important thing is not to go out and mingle with people who could be having this. So we prevent the exposure that we have. The other thing is that during this time, try to build up your immunity. Now, to build up your immunity, you would have seen a lot of messages and things in the social media, but some of them are false. So be wary of the false information. But for the actual things, immunity depends a lot on your lifestyle as well. So proper food in the sense of balanced food with vegetables and fruits, giving you antioxidants, etc. Vitamin C is said to be good, so natural source of vitamin C like citrus fruits and all would help you in general immunity, not as specific against corona or something, but as a general immunity. Drink water at least 2 to 2.5 liter or 3 liter per day. Take adequate rest. You have to rest or sleep for 7 to 8 hours in a day. Do at least 30 minutes of exercise, some sort of exercise, either walking to and fro in your house, because you cannot go outside, would also be enough. So do that regularly. If you do that, keep all these things up. So even if the virus attacks us, the body immunity will take care. So all the other steps which I told earlier also, we have to be careful. Now, in this time, we have one thing to be cautious, and we are hearing this from our colleagues, that patients who are genuinely ill also. For example, we had a doctor tell us that a person who suffered stroke was not willing to go out of his home and stayed at his home for 3 days, and it's only after the 3 days that they thought of calling the doctor because they wanted to stay at home. So the window period of 3 days is not very small for a disease like stroke. So similarly, somebody has a genuine concern, like something that can flare up, maybe a chest pain or dyspnea, or acute pain in the abdomen, or something like that, seizures. So don't think that it's a condition that you should not go out at all. So in these scenarios, wherever you have a problem, an acute problem, a pain somewhere in the body, a new pain, something, or if you are a chronic patient who is already on medications, please make sure that you have access to supply of medicines to continue your medications at least till 1 to 2 months. Even if you don't test a lot of your blood parameters and all that, at least make sure you are continuing the medications as such that you are having. So in order to facilitate this, all the healthcare providers, or most of the healthcare providers, have some sort of service that can be accessed remotely, or they would come to your home. So we at Abeer are also doing this. With our call center number, we are trying to coordinate to all our facilities in Saudi Arabia, in Jeddah, Riyadh, Makkah, Medina and Dammam, where you call our call center number, which would be there on the Facebook page of Abeer. They would assess the requirement. So either they would arrange a teleconsultation with the doctor that you requested or the specialist that you requested, which they can advise you on what to do if you want to do a lab test, or if you want to do a medications. In most areas where we are present, we are also able to deliver these medications to home. And one other thing is that the pediatric vaccinations for kids who are in the vaccination age bracket, it's also important that we get them regularly that vaccine. So these are vaccinations to prevent some bigger illnesses in the future as well. So it's important that they take these vaccinations as far as possible. For that also, there is a home vaccination service. So wherever you are, try to identify the facility who has provisions for all this and contact them. So it need not be any particular company or brand, but whatever is near your place, please make sure that you contact them and take care. So this is in brief about the current understanding of the situation in Saudi Arabia. Government is doing all it can. We are very proud and we should be very confident of the place we are staying in right now. The government is doing really well. The Ministry of Health, under the guidance of the minister himself and the Crown Prince and the King, they are putting up a very good effort in combating this. So they, as you already know, they are coming out with a lot of financial schemes also to address the situation, which will hopefully be a relief for majority of us in this situation. So thank you very much. I just thought this would be important for at least some of you. and we will probably come regularly to update you of if any changes are there in this current scenario. Thank you all. Have a nice day or week, and stay indoors and stay protected. Stay safe. Thank you.